And thanks, for the opportunity to talk to all of you tonight about comprehensive cancer care and give you a feel philosophically for what comprehensive cancer care is and a little bit about my philosophy of taking care of patients and a little bit about the philosophy of the Cancer Center that we are creating here at Mercy. So, what is multidisciplinary patient-centered cancer care? First, let's just break it down. Multidisciplinary is pretty easy to understand. There are very few patients in the United States that are treated for cancer that don't have more than one specialist involved. And in the world of cancer, the disciplines, those are the different specialties that treat cancer, are primarily surgical specialties, radiation specialties, and medical oncology. So that's the multidisciplinary part. But what I really want to focus on is what does it mean to have patient-centered care? The Sir William Osler, one of the founding members of Johns Hopkins Medical Center, said, "The good physician treats the disease. The great physician treats the patient who has the disease." And I would take it one step farther and say that patient-centered care is about taking care of patients and their families rather than treating the disease. In the process of taking care of patients and their families, we certainly treat the disease, but it's so much more. The Institutes of Health did a major paper on the focus of cancer care in the new century, and really one of the fundamental objectives of cancer care needs to be patient-centered. So what does it mean to be patient-centered? We're going to talk a little bit about the physical idea of patient-centered, but much more about the human-to-human interaction. Taking care of patients and their families are human beings taking care of human beings. Patient-centered puts the patient at the center of the entire endeavor. And that may be physically putting them in the center, so creating spaces that are designed with the patient's convenience and outcomes foremost rather than the providers. And it's also the way that philosophically we take care of patients. Number one, it's about taking care of the whole person. So again, it's not about treating disease. It's certainly not about killing cancer cells. It's about taking care of the entire patient. And that means obviously the physical, which includes the cancer cells, but much more importantly, it includes the emotional, the psychological, the philosophical, the financial, the spiritual dimension of what a patient and their family is going through. So that whole person concept is absolutely essential when we're talking patient-centered care. It also brings the entire family into the picture in a conscious effort of collaboration, collaborating with the patient and their family in coming up with an overall treatment plan. Another essential component of patient-centered care is communication. The ability for the care team to communicate with the patient and the family, not only to review the medical information, but to also communicate the goals of therapy, the side effects, the risks, the alternatives, and to be engaged in listening, another key component of patient-centered care. Another component of patient-centered care is relationships. It's been said that people don't care what you know till they know that you care. And having a very centered, deep, trusting relationships between the patient and the caregiving team is essential to a patient-centered care. Accessibility. Not only should the cancer center and the services be physically accessible, but the care team should be accessible to the patient not just in person at the time of meeting, but there should be ways in which the patients and the families can communicate with the care team via phones or emails or patient portals, all sorts of different techniques. Timeliness, in order to be patient-centered, one of the greatest concerns that patients and their families have is that they get the treatment started expeditiously. Part of our job in patient-centered care is to explain, well, first things first, we need to first understand what's going on and then to formulate a plan of care. But one of the criticisms of care in a very complex health system is there are often delays. Sometimes the delays happen. So a typical scenario might be you see your primary care doctor with a symptom, and that leads to an x-ray, and that leads to an abnormality that may take a week to learn about the abnormality. And that then leads to a referral for another test or to see a physician. And your primary care doctor scheduler may call the scheduler in a cancer doctor's office, who then gets an appointment a week down the road. You see that particular cancer doctor, and they say, well, we need to do another test. And you go taken to the scheduler's office, and that scheduler calls the scheduler at the office for the next test, and another week goes by. And then you see another doctor whose scheduler calls the scheduler of another doctor, and another appointment is set up a week or two. And I'm not exaggerating, that sort of process is what happens when you just let the system that isn't truly integrated and patient-centered take place. And the next thing you know, may have been months that have gone by from the time that the symptoms developed until actually a care plan is developed. So timeliness means creating a system that is able to break through that delay where you have serial scheduling of appointments, and to bring the patient in the center and create a system where those delays are eliminated. The patient-centered care also is a type of care that practices narrative medicine. And narrative medicine is, again, back to the principle of patients really not caring what you know till they know that you care. This is not about treating diseases, it's about caring for patients and their families. And in order for your care team to be able to understand what your goals and desires are, it's really important to know a lot about you as a patient, not just what was the x-ray, where is the cancer, and how are we going to treat it, but what is your background? Where did you grow up? What's your education? What's been your profession? Who are the important people in your family that you turn to for support? What is your understanding of God? What is your understanding of your mortality? And these are questions that you don't just hand a patient with a clipboard to fill out while they're waiting in the waiting room. These are characteristics of someone's true nature, culture, philosophical perspective that you learn about in engaged conversation. And the practice of narrative medicine is really engaging in conversation. So they've done studies when a patient and a doctor are in a room together, and a doctor asks a question and the patient starts to answer, and the average is the patient gets to speak for about 30 seconds before interrupted by the doctor. Narrative medicine isn't just sitting back and allowing the patient to talk, but engaging in conversation and actively soliciting information about your background, your culture, your beliefs, your philosophy will make it so much. Number one, it establishes trust in the relationship, and that relationship is just such a good rock steady start. And number two, it allows us to understand you and where you're coming from and who your support system is, so that when we do come up with a plan of care, we'll have a plan of care that is centered around your beliefs. And finally, and maybe most importantly, patient-centered care requires compassion. So what's compassion? Well, if you go back to the Latin roots, the word for compassion literally means to suffer with someone. And the idea of compassion stems, first of all, from some form of suffering and being attentive to suffering. And not just attentive to the suffering, understanding there is suffering present, being attentive to it with the desire to alleviate suffering. So in the realm of compassion, there are several other emotions or types of interaction that are similar but not exactly the same. So we might start with the idea of pity. So you might be observing on TV some person in a bad situation, and you might just feel pity for them. It's just kind of sad to look at. You're sorry they're going through this. A second level, a little higher, would be what I would call sympathy. You not only see that someone is suffering and feel bad for them, but there is a bit of a desire that they wouldn't be suffering. The third level, I would call empathy, where you actually try to feel what that person who is suffering is feeling. Empathy is in many ways putting yourself in the shoes of that person to try to take on a greater sense of feeling what that person is feeling. But the highest level of engaging is compassion, where you don't just try to feel what that person is feeling, but you try to actively engage in some form of activity that will relieve the suffering. I like to quote the Dalai Lama, who was comparing the difference between empathy and compassion. And so he was saying, if you're hiking along in the Himalayas on a mountain trail and you come across someone where a rock has fallen and pinned them down, empathy would be getting down on your hands and knees, feeling what that patient is feeling. Compassion is moving the rock off the person. So it's an active endeavor that recognizes the suffering, empathically understands it, but then takes one step further and tries to actively relieve the suffering. So patient-centered care is all about healing, caring for the patient and the family in an attempt to relieve suffering. And we've already outlined the different characteristics that can allow us to accomplish that. Fundamentally, it's a whole person endeavor. It's not about killing cancer cells, it's caring for patients and their families in all aspects of the care. So that is patient-centered. And I want to share with you a story that was written by Dr. Rachel Naomi Remen. She is clinical professor at the University of California, San Francisco School of Medicine, and that happens to be where I did my radiation oncology training. And this is a story that characterizes a little, in real life situation, what patient-centered care is. She wrote the story. This is from her book, Kitchen Table Wisdom. It's about a man named Dieter, who's a member of one of her cancer support groups. Dieter had escaped from communist East Germany, and after many years as a refugee, he'd made a new life for himself in the United States. At the time that she got to know him through her support groups that she was leading, he was living with incurable cancer. She writes, for some time, Dieter had suspected that the chemotherapy he was receiving for his cancer was no longer helping him. Convinced at last of this, he spoke to his medical oncologist and suggested that maybe the chemotherapy could be stopped. Dieter asked if he could still come in every week just to talk to his doctor. His oncologist responded, no, therapy, there's nothing more I can do for you. So Dieter continued to take the weekly chemotherapy in order to have a few moments of connection and understanding with his doctor. The group in the Dieter support group listened intently, and after several minutes of silence, Dieter said softly, "My doctor's love is as important to me as his chemotherapy, but he doesn't know." Dr. Remen continued her story with a personal reflection. She says, "Dieter's statement meant a great deal to me. I had not known either. Medicine is as close to love as it is to science, and its relationships matter even at the edge of life itself." As it turns out, Dr. Remen had another connection to Dieter's stories. Dieter's oncologist was actually receiving some psychotherapy counseling from Dr. Remen. Week after week, she says, the oncologist had come in with chronic depression. The physician would tell me that no one cared about him. He didn't matter to anyone. He was just another in a white coat in the hospital, a mortgage payment to his wife, a tuition check to his son. No one would notice if he vanished so long as someone was there to make rounds or take out the garbage. So here is Dieter, bringing the same validation, the same healing to his oncologist that he had brought to me, but his doctor, caught up in a sense of failure because he could not cure cancer, is unable to receive the healing. So a true story, and obviously gets to the point that being a cancer center, being a cancer doctor, being providers in a center taking patients is not about killing cancer cells. It's about taking care of patients, and that compassion is the number one essential component of patient-centered care. And that if done correctly, not only will patient-centered care give the patient the best possible outcomes, but it will also be incredibly rewarding to the care team that gets to engage in patient-centered care. So that's what patient-centered care is. We've defined what multidisciplinary is, meaning more than one discipline. I want to also talk about what does it mean to have comprehensive care. So you could have a radiation center that is a freestanding center that gives radiation treatment. By itself, that wouldn't be comprehensive care if it's part of a system where the patient can get all of the other components that could be part of it. But the comprehensive part is not just killing cancer cells, but being able to provide a comprehensive assessment of what the problem is, meaning diagnostic imaging, CT scans, MRI scans, PET scans, the ability to do biopsies, having pathologists can look at the biopsy and determine what type of cancer it is, having access to all of the advanced molecular and genomic testing that looks not just at what does the cancer cell look like under the microscope, but really what are the fingerprints of the cancer, what are the cancer cells' genetics and the cancer cells' molecular features that may indicate treatment. Then, as I said, comprehensive also means you've got all the various specialties that are involved. We talked about the surgical specialties, radiation specialties, medical oncology specialties, but it also is bringing in pulmonary lung doctors, the heart doctors, the neurologists, bringing in the social workers, the financial counselors, the rehabilitation specialists, and the dietitians, and the genetic counselors. So comprehensive cancer care brings in all of those specialties. But again, it's all patient-centered. So we've talked about patient-centered, we talked about multidisciplinary, we talked about comprehensive. Now let me give you a vision for what we are planning to create at MercyOne Cancer Center. We're in the process now of building a space that will help us deliver patient-centered, multidisciplinary, comprehensive care in a space that will actually accentuate the patient-centered. Now, you can be patient-centered without a specific facility that does it, but a facility can really help actualize the philosophical concept of patient-centered care. And what we are creating in our new space are 4 new clinics in this space. The space is going to be beautiful. It's going to be accommodating to patients and their families, with rooms large enough for patients and their families all to come in person. Also have IT facilities so that some family members who can't be present in the room, who might be in another part of the country, can participate in the consultation remotely. And the idea is that a patient, once they have a new diagnosis, patient and family would come to the center, and they would be in one room that accommodates all of them, and all of the different specialists that are involved in that patient's care would meet with the patient and the family during that one appointment. So we talked about how many times you see one doctor in one office whose scheduler schedules you to see another doctor in another office a week later. By the time you get through all the specialties, a month has gone by. This is bringing the specialist to the patient who is in the center of the experience. And this facility will help accommodate the philosophical approach of patient-centered care. Some of the benefits of the patient-centered care approach in a multidisciplinary clinic will be decreasing the time it takes from diagnosis to treatment, enhancing communication, enhancing patient support, and enhancing the entire trusting relationship that happens between the patient, their family, and the care team. So that's one of the clinics that will be happening in the new cancer center facility, and that's the multidisciplinary cancer clinic. The plan would be that different types of cancers would use that facility on different days. So one day it might be patients that have been diagnosed with lung cancer. Another day it may be patients diagnosed with breast cancer. Another day is patients that are diagnosed with colorectal cancer, et cetera. As I list all of the people that will be present in that space, I'm sure I've forgot some, and I didn't mention all of the nurses that are involved in patients' care. So not only does each doctor and specialty have a nurse, but we also have at the Cancer Center what we call nurse navigators. And those are experienced oncology nurses who are present in the room with the patient and the family through all of the different doctor encounters. The nurse navigator can help patients formulate the questions, make sure they understand what the doctor has said and recommended, and help not only navigate them to the treatments, but to navigate services to the patient that they may need at the time they need them. So that is one of the 4 clinics that will be happening in the new space, and that is the multidisciplinary cancer clinic. The second clinic that we'll be developing, that's all around patient-centered care, is the survivorship clinic. Now, there are different definitions of survivor. One broad definition of survivor, and the definition we use when we're talking about our survivorship program and all the programs that we have for survivors, is from the time of diagnosis throughout the cancer journey, you're a cancer survivor. Whether you've just been diagnosed and haven't started treatment, whether you've been diagnosed, have a curable cancer and are done with treatment and are cured, or whether you are having incurable cancer and are forever undergoing treatment, or you're somewhere in between because your status of being cured of cancer may change over the course of time. So that's one definition of cancer survivor. But for the purpose of the survivorship clinic, which is different than the survivorship program, the survivorship clinic is being developed with a specific type of survivor in mind. And that is the person who is likely cured of their cancer. The demographics, when we look at the United States for the next 20 years, I'm part of the baby boomer generation. And as many of you know, we just ballooned the population, and we're now all approaching Medicare age or in Medicare age. And the older you are, the more likely you're going to develop cancer. So the statistics are, even though the incidence of cancer based on the age of the population isn't going to change, there's going to be more cancers because there's more of us that are older